While you know that I've been extremely patient for the last few weeks when I have said we're going to do everything we can to get more compliance with current restrictions and mitigation measures, today we're going to have to move a little bit further than that. And we are trying very, very hard not to revert to phase one or to phase two because we are trying to balance the public health imperatives with the economy on the one hand, with the ability to open schools next month, and a whole lot of other things that are going on. So today I'm going to announce that we're going to stay in phase two as our current proclamation has us at least until July 24th, and we're going to examine what's going on at that time and figure out what happens after July 24th. But there are going to be some changes effective on Monday. I will sign an executive order today. The changes that I'm going to talk about will be effective on Monday, and by Monday I mean Monday morning, one minute after midnight on Sunday night. The changes. Masks are now mandated statewide for everyone age 8 and older, unless they have a major health condition that makes it difficult to wear a mask. And by the way, it is strongly recommended by the CDC and by us that children between 2 and 7 also wear a mask. The mandate won't apply to them, but the guidance still does. Parishes and municipalities may opt out of this mandate if they don't have a high incidence of COVID-19. I'm going to get more into that in just a moment. Right now, there are only 3 parishes in the state that don't have that high incidence rate that the CDC has put forward. Also, I want to talk about the fact that all bars with and without food permits will be closed to on-premises consumption. They may engage in curbside pickup. Indoor gatherings will be limited to 50 people total. Now, this does not, and I want to make sure this is very clear, this does not change what's in our proclamation for phase 2 with respect to occupancy limits of businesses. Essential businesses have no limits. Non-essential retail, places of worship, other places have a 50% occupancy limit, but with requirements for social distancing. These are social gatherings that we're talking about here. The limit will be 50 people indoors, and outdoors there will just be a requirement that they have to properly and strictly physical distance. I do want to point out that what we have good reason to believe is a large contributor to the spread and growth of cases are informal backyard gatherings, if you will. So these are the birthday parties, the wedding showers and baby showers and those sorts of things where people are just having these rather informal gatherings, and they think, well, I'm only inviting my close relatives and my close friends. Well, guess what? Many of your close relatives and close friends are going to have COVID. And what you have to do is make sure that you are following these rules too with anybody who is not part of your immediate household. So if you're going to have these informal gatherings, we really, really encourage you to keep them as small as you can. Make sure that you wear masks and that you physically distance, and have them outdoors if you possibly can. That's the safe way to do that. As I mentioned, the changes are going to go into effect on Monday night, right after midnight, because we did want to give business owners and the public time to comply. These orders will stay in place at least until July the 24th, which is when the current proclamation is set to expire. We will continue to look at the data and decide later what happens after July 24th. I do want everybody to understand we have been extremely patient, but we're making these decisions today because of the data that we have and the recommendations of public health experts. We're also following White House guidance, which bases reopening gating criteria, including declining new cases and hospitalizations and positivity. And right now we don't have any of those. In addition, the White House, including Vice President Prince, who leads the White House Coronavirus Task Force, and by the way, we look forward to hosting him in Baton Rouge here on Tuesday. But they've encouraged the public to follow state and local orders regarding face masks and encouraged that government consider face mask mandates where cases and positivity are increasing. And certainly that is the case here in Louisiana. Face masks and cloth facial coverings are easy. They're an effective way for people to protect each other from the spread of illness. And I've got 3 doctors here with me today who agree with that. And you're going to hear from them in just a few moments. So just to get back to the face mask a little bit, the order includes CDC guidance and requires face coverings for everyone ages 8 and older, except for those with medical conditions that prevent the wearing of a face mask, anyone consuming drink or food, anyone who is trying to communicate with a person who is hearing impaired, anyone who is given a speech for broadcast or to an audience, anyone temporarily removing his or her face covering for identification purposes, and anyone who is a resident of a parish without a high COVID incidence rate that is opted out of the masking mandate. Now, we look to CDC for guidance here, and high incidence of COVID are considered those areas with more than 100 new cases per 100,000 people over a 2-week period. So that's, again, those areas where you have more than 100 new cases per 100,000 people over a 2-week period. Those areas with a high incidence of COVID-19 with respect to the CDC guidance. 3 parishes are below that threshold. They are Grant Parish, Red River Parish, and West Feliciana Parish. And so we have set up so that the parish governing authorities can, with a communication, a letter to GOSEP here, can opt out of the face mask mandate. Now, let me tell you, whether they opt out or not is going to be a decision for them, but it is still strongly encouraged that everyone who can do so to wear a face mask when they are outside of the home and interacting with people who are not part of their immediate household. Because while these parishes may be the least affected in Louisiana, there is COVID currently in every single one of those parishes as well. I would also remind people that if you have a health condition that makes it where you shouldn't wear a mask because you have breathing difficulties, then you have a health condition that makes you vulnerable to COVID-19, and you need to exercise extreme caution under any circumstances. And remember, you are always safer at home. If you are vulnerable, if you are 65 and older, if you have diabetes, hypertension, kidney disease, heart disease, if you are obese, you are better off at home. And certainly, you shouldn't be out there without a mask because you have a breathing difficulty any more often than is necessary. So just understand that. So at the end of the day, while I know that this is going to be unpopular with some and controversial with some, we know that face masks work. It really is that simple. The vast majority of the spread of this disease comes from people talking, breathing, sneezing, coughing, and that face mask limits the distance that those particles containing that virus are going to be sprayed to neighbors. None of these steps that I'm announcing today were steps that I wanted to take. I have mentioned that over and over. None of them are easy, but I do think they're all essential. And I think you are seeing these steps that I'm announcing today being taken in more and more places across the country, and I look for that to continue. And I do want to remind everybody that there's typically a 14-day lag between any change in behavior and when that change starts to show up in the numbers, whether it's the number of positives or the number of hospitalizations. And it's even a longer lag time after that before there's a change in the number of deaths. So we're not going to see any changes in the very near future. And I want people to understand we have no reason to believe that the numbers that we've been reporting over the last few days are going to get any better over the next couple of weeks. In fact, they are likely to get worse. That's the unfortunate reality, and that's why we are taking the action that we're taking today. Obviously, closing bars is not a step I wanted to take, but the reality is, here in Louisiana and elsewhere, bars are proving to be hotspots for the spread of coronavirus. And it's probably not true for every bar, but we know that it's true for many of them. And I want to thank all of those bar owners who did work hard to comply with the current restrictions. And understand, nothing I'm announcing today is designed to punish anyone, especially bar owners. But it's a simple acknowledgement of the reality of the situation. You know, through our limited contact tracing results that we've gotten, we've identified at least 36 outbreaks impacting at least 405 people from bars since the start of the outbreak. And we know that that number in reality is much higher than that. And if you remember, during phase 0 and phase 1, bars were closed. So all this has happened in phase 2. And we also know that leading the spread over the recent weeks has been a younger age group, those who are much more likely to frequent bars. And by the way, they continue to be a big driver of cases. And I think Dr. Cantor is going to tell you more about this in just a moment. But it's pretty clear that younger people are spreading. We thought we were fearful that they were. We're very confident now younger people are spreading COVID-19 to older people who are getting this disease again in growing numbers. So public health officials believe going to bars is a higher public risk than visiting other types of businesses, simply because you go to a bar to socialize. And when you drink, you're not wearing a mask. And when you drink, you lose your inhibitions. And when you're listening to music, you have to speak louder to be heard. And you have to move closer to other people to hear them. And there's just nothing about that environment that is conducive to slowing the spread of COVID-19. And that's the unfortunate reality of the situation. Before I turn this over to our doctors, I'm gonna just say this one more time. I know that some of what I'm announcing today is going to be challenging for some, unpopular with others. It is the necessary thing to do. It is the right thing to do under the circumstances. That's why we're going to do it. And we cannot let this illness win. And if you, like me, are interested in keeping as much of our economy open as possible, if you don't want to have to regress and go back to phase 1 or phase 0 in order to preserve capacity at our hospitals, if you want to open school next month and higher education next month, these really, in the grand scheme of things, are minor prices to pay, especially those people who don't like the inconvenience of putting on a face covering. Now, I don't like it, but at the end of the day, I know it's the right thing to do. Should not be a political issue either. And for some reason in this country and in the state of Louisiana, there's been a political dynamic that has kind of emerged around the whole issue of masks. That just doesn't make any sense to me. And I think people, if you will pay attention even to the national scene, you have started to see, and you're going to continue to see, people of both parties who are going to be stressing the absolute importance of wearing a mask.